What's going on, everyone? Happy Monday. Hopefully everyone is doing well, staying safe, healthy. I hope you had a great weekend, but I also hope you tested negative for the viruses if you had to take a test. It is time now for the Monday edition of the Virus Update for Monday, August 11th, 2025. If you're new to my channel, welcome to my channel. You just reached the channel that gives you the updates on all the viruses that can make us sick. There's a lot of viruses out there. COVID's one of them. COVID's still there, and it's here to stay. We're dealing with a summer surge as we speak right now. It never really fully went away, and well, right now this surge is continuing to get worse. Want to stay informed on that and other viruses? Subscribe down below. If you like today's video, give it a thumbs up. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. Alrighty, we do have several things to take a look at today in the news department. Plus, we're going to take a look at some daily data and some wastewater data. I do have one place I found in the United States, something I don't think we've ever seen before on wastewater scan when it comes to Mpox. So you'll want to stay tuned for that. And if we have seen it, let me know when we get to that. All right, starting off with the BNO Weekly U.S. COVID update. Yeah, the numbers continue to go up, including deaths this week. New cases, 86,329. That's estimated. Doesn't include the people who don't test or at-home test. Admissions, 6,043. That's up by 18%. In the hospital, 4,317. That's up by 16%. In the ICU, 532. That's up by 13%. New deaths, 224. And that actually took the average up now to 201, which is up by 8%. COVID cases continue to rise for the fifth week in a row and are now at the highest level since April. Hospitalizations are up among all ages. So far this year, more than 3.5 million COVID cases have been reported in the U.S., causing 246,050 hospitalizations and 16,812 deaths. Both of these numbers right here, the hospitalizations and deaths, they're going to be going up much faster, as will cases. We're going to see by the end of this wave, we'll probably be well north of 4 million cases in the United States, and hospitalizations will probably, go north of 250,000, and deaths, I don't know how high that's going to go, but yeah, things are going to continue to go up. All right, Walgreens has updated. We're going to do this a little bit different than we normally do. I'm going to show you some stuff from Sci-Fi here in relation to Walgreens. Then we'll go to the actual dashboard. He put breaking. This was as of just a little while ago. Walgreens reports U.S. hits new 2025 summer COVID-19 testing high. Yes, in other words, more people have gotten tested in the past week at Walgreens than any other week of the summer, which suggests there's more of an interest for people to get tested because either they had contact with someone sick, they are sick, or they're just trying to be precautious. Chances are they are sick. It's up by 13.6% from last week, indicating a surge in demand. California hit a positivity rate of 40%, the highest since August, I believe, 23rd of last year. And then you have Arizona, Colorado, Indiana, Illinois, and Arkansas have the largest percent increases. U.S. positivity rate, though, actually went down a little bit. Remember, testing went up. So in this case, the number of more people getting tested was enough to bring the positivity rate down a little bit. Some of that could be because you see some green on that map. It's Florida. Florida is starting to show signs that I think Florida is peaking. We'll take a look at this. And you know what? We'll start off the Walgreens map in Florida. Take a look at that. You can see here there's signs that it may be peaking. There on this map, I've been seeing less sick person calls in Pinellas County. I've also noted some of the wastewater sites in Florida are starting to drop at this time. So perhaps maybe a little bit of good news in the south at this point. But nonetheless, there's a lot of other places that are just not doing good. Take a look at Washington, for example. Yeah, Washington, the state, not D.C., the state is at 47.1% COVID positivity rate. 35.7% last week. Well, that makes it be up 11.3%. 34 tests versus 28. California, there you go. 38.1% positivity rate, a difference of up 5.1%. Take a look at Illinois. Illinois now has a 37.4% positivity rate, up 11.5%, literally jumping straight upward. Louisiana continues to be bad, 42.2% positivity rate there. Arizona, 41.8%. Pennsylvania, 43.8%. I'm getting concerned about Pennsylvania. Tomorrow we're going to get the states wastewater update, but I'm going to show you some wastewater scan before this video's over. There's 2 wastewater scan sites, Pennsylvania, and I don't like what either of them are doing at this point. Alabama at this point is 25% positivity rate. North Carolina, 33.1%. New York is 27.4%. Oregon at this time is 16.7%. All right, moving on. We have a lot more things to take a look at. Mike Horger posted about Hawaii. The CDC indicates that the surge in Hawaii has continued to increase. They characterize transmission as very high and up from last week. PMC now estimates, yikes, 1 in 28 actively infectious. And he will have a full report late today, it says, and we'll have that into tomorrow's virus update, not today's. All right, moving on to this. We're not going to read the full study. I'm just going to read a little bit here. Study examines impact of long COVID on healthcare use. U.S. adults with long COVID had higher rates of additional hospitalizations in the 6 months after acute infection. In other words, after testing positive, the initial phase. Then comes long COVID, compared to those who had SARS-CoV-2 infections but not long COVID. Researchers reported last month in PLOS1, the study led by researchers with Rush University Medical Center and Yale School of Medicine, was a secondary analysis of a prospective multi-center study in the U.S. And would you believe it? Yes, there is more use for healthcare after a COVID infection for those who have long COVID. Now, like I said, we're not going to read the rest of this, but I will be making a thread today. And of course, this will make it into the archives on my website, and it will go into the long COVID section. But take a look at this. Nearly 3-fold increased risk of additional hospitalization. So I thought, since they did this, why don't I just take a poll among my followers over on X? Now, it did not get a lot of results, unless something's changed since I looked at it last. But it's at 89 votes, likely to go higher. I'm going to repost this again later on. I think it'll go over 100 votes, and, I'll show you the final results tomorrow. But as of right now, for those with long COVID, have you had to use ER post-COVID? Some answers may get used on a virus update. 59.6% said yes. 40.4% said no. That's out of 89 votes. And yeah, some said heart palpitations. That seems to be a common thing I hear a lot. People saying they're dealing with that heart issues post-COVID. Leo said several times for chest pain, shortness of breath, numbness, neurological symptoms, and so on. Pam said she had to take her daughter for an allergic reaction. Yikes. Not good now. They're saying allergic reaction. I think they mean COVID and not the V word, vaccine, because I get so many comments about that. All right, moving on. Israel, just going to quickly go through this one. Israel Health Ministry reports 93 new diagnosed cases of measles, and I believe that brings their total here to 410. So Israel does have a measles problem as well. It's hitting everywhere around the world. All right, Berks County, Pennsylvania, West Nile virus has been detected in the area. In the mosquitoes, testing has been done, and they are seeing West Nile virus there. Also, first confirmed case of West Nile virus has been confirmed in New Orleans this year. West Nile virus is a problem, and I'm starting to see more news stories pop up about that. In fact, I'm making it one of the things that I now search when I do my searches. I don't always go through my entire list of things that I should search, but from time to time I go through various different things on the list, and I decided, let's type in West Nile virus, and I did, because, it is August 11th. We're in the midst of summer. This is when West Nile virus really starts to take off at this time of year, and unfortunately it is, and I think we're going to see more reports of it. Some places are having a ton of rain. A lot of rain leads to standing water. Standing water leads to more mosquitoes. All right, a channel note. This is a very big channel note. I owe you guys a big thank you. I started this channel back in July of 2022. Of course, when you start a channel, you have 0 views. Well, guess what we hit over the weekend? 1,177 channel views. Total channel. That includes the shorts as well. But even then, if you cancel out the shorts, long-form videos alone, that's probably going to go over 1 million views very shortly. So yes, total channel views have now hit 1 million. And I thank everyone. I think our next big milestone, which we'll probably hit before the end of the year, is going to be 10,000 subscribers. Tell your friends, tell anyone you want to inform about viruses. Hey, go follow that data report over on YouTube. Again, thank you so much to everyone who watches my video. It's been a long ride, of course. You know, since we started these videos, things have changed. We record at a different place now. You know, long COVID, I'm not down at the house that I used to have before. Things have changed. Our microphone has gotten better. See, now we use this microphone. Not that old headset. Hey, I still have it as backup. But yeah, thank you so much. All right, moving on. The viral activity levels in Canada for COVID are moderate. Flu A is low. Flu B is low. RSV is low at this time. All right, do I have to show you air qualities? Now, you're still going to see bad things on this map. I sound like a broken record. Air qualities. I mean, yeah, yellow in the Northeast once again. And take a look at this in the Dakotas. Or I should say just east there, Minnesota. I'm concerned it's starting to spread southeast again. I don't know that it's going to make it into Northeast. I haven't looked at the wildfire smoke models. I haven't looked at the wind directions on the models. In fact, I've been paying attention to the Atlantic. Yeah, there's now Tropical Storm Aaron out there. I wonder what that's going to do. Should stay out to sea, but who knows? So yes, the smoke, it's getting closer to Chicago. It's not far off from Chicago. You really want to keep an eye on this because it's been oh so bad. And this probably won't be the last time it happens until something gets rectified with these ongoing wildfires in Canada. It's going to continue to be a problem. And then, of course, we have the wildfires on the West Coast, which some of that does spread east as well for some of these southern states. So air qualities, if you're in anywhere that's in yellow or worse, you want to take it seriously, especially if you have asthma or another problem. And even if you're, say, not in one of those areas, but it's like really hot and humid out today, yeah, that sometimes can make it harder for you to breathe as well. All right, taking a look at what's going on in Pinellas County, Florida, we do see a lot of calls at the moment. I see 1, 2, 3 calls for sick person, but it's not what we were seeing before. Remember, it was 8, 10 plus calls at times. We're not seeing that. All right, Philadelphia had 769 EMS incidents on Saturday, and on Sunday they had 767, so below 800. That's something I'd like to see. Hopefully we will get an update on our wastewater and other metrics for COVID here this week. I don't know. Usually there's a monthly update and should be coming anytime now. Montgomery County, Pennsylvania currently has 16 EMS calls, and I'm seeing several different things here, and COVID is starting to go up here in the state of Pennsylvania. Taking a look at what's going on in Chester County, not much. That is good to see. And in Bucks County, Pennsylvania, I do need to refresh just because that was way behind. Just 5 EMS calls at this time. Taking a look at what's going on with the hospital situation in Pennsylvania, we do see some yellow hospitals. There are some hospitals that are busy in eastern Pennsylvania, also one in south central Pennsylvania. Fulton Medical Center has a trauma diversion. I didn't know they did trauma at that hospital. I thought that was a smaller hospital, but what do I know? Taking a look at New Jersey, we do see, yeah, a few hospitals are dealing with patient volume at this time. Wow, several are actually dealing with some sort of an issue today. It looks like 4. So that's more than we've seen in some time. New York State, 404 people have tested positive on the most recent update. And New York State COVID hospitalizations went back up a little bit again. 346 people hospitalized and 41 in the ICU at this time. Now let's take a look at some wastewater data, shall we? We'll just spend a couple minutes here. First off, COVID is high in the Northeast, high in the South, medium in the West, and medium in the Midwest. And I did want to show you Pennsylvania. Take a look at this. We'll get the Pennsylvania update tomorrow from the state's wastewater and, well, also the what's going on with the emergency department. Because I believe that's the only other thing that's going to update. Let me refresh this. Why is this not bringing us to Harrisburg, Pennsylvania? We do need to take a look at Harrisburg, Pennsylvania. And look at this. The level is high and continuing to rise at this time. And then we come over here to Chester, PA, and take a look at this. Yeah, now there's a little wonky movement at the end, but even if you X that out, it is rapidly going up. So I'm concerned with what's going on here in Pennsylvania. Let's go somewhere in the south. Columbus, Georgia at this time. COVID levels continue to go off. They may be slowing just a little bit And now let's be fair and go out to the west. How about we take a look at Boise, Idaho? Look at that. Both wastewater sites in Boise, Idaho coming up high and still rising. There's West Boise. Here's, this, I guess this would be Eastern. Lander Street, Boise, Idaho. Wow, this wastewater site is rapidly going up. That, my friends, is not good to see. Now, let's for a moment change this. I just saw norovirus. Hold on. Norovirus is listed at high. Now, why is it saying high for norovirus? I mean, it's coming up low on the map. Sometimes this does not make any sense to me. All right, I want to show you Mpox clade 2. Now, if you notice here, we're getting close to Chicago. Let's take a look at Wheaton, Illinois. This is something I have not seen. First off, your COVID is medium, rising slightly, but take a look. Ooh, look at EVD 68. Wow, that is high and rapidly going up. That's not good to see. But take a look at this. Mpox clade 2 is listed at medium. Yes, medium. I don't ever recall seeing Mpox clade 2 listed at medium, but again, what do I know? Maybe I'm wrong. Maybe I just don't remember. You know, it's been doing a lot of these videos over the past few years. But take a look at that. Yeah, several detections of that. That's not something that we like to see. And of course, the other site where we have Mpox, do we have anywhere else with Mpox? I am seeing a low listed in the southeast. That means somewhere has an Mpox case. Oh, well, I'm probably just not finding. I'm also seeing the West Coast. Well, look at this. We have Mpox being detected in San Francisco. San Francisco for COVID, you can see, is high and continues to rise at this time. And we also see here, let's see, Mpox. Yeah, clade 2 is low. And measles, there's still that detection showing up there as well. Alrighty, folks, that does it for the Monday edition of the Virus Update. We will have another Virus Update again tomorrow. Again, I just want to thank everyone. 1 million views we hit here on the channel. That is a huge milestone. Here's to 2 million, and here's to my goal of 10,000 subscribers. I'm sure we'll have a bunch more things to take a look at tomorrow. Of course, like I said, we'll have Pennsylvania. We'll have the first day of the week for New York State. That's very important. We want to see how much New York State hospitalizations rise on a Tuesday. Often, their biggest rise for hospitalizations for COVID is on a Tuesday. Of course, we'll be following this West Nile virus issue. Yeah, that continues to grow. And, well, whatever else pops up tomorrow. If you enjoyed today's video, give it a thumbs up. Subscribe down below, hit that notification bell, share this video with anyone you know, and of course leave your comments down below. Let me know, do you like when I do those little 30 to say 59-second, well, you can only do a 60-second short, or have they changed that? I don't know. Do you like when I do those little previews? Maybe we'll do them once or twice a week. Alrighty, folks, thanks for watching. Have a fantastic Monday evening, and see you again tomorrow. But until I see you again tomorrow, stay safe, everyone.